The purpose of this video is to learn the IDDSI dysphagia framework, understand the technique for thickening liquids, observe at least 3 different consistency examples, and inform you on how to thicken a liquid. What does dysphagia mean? It is a swallowing disorder defined as problems involving the oral cavity, pharynx, esophagus, or gastroesophageal junction. In simpler words, this means difficulty swallowing. Malnutrition and dehydration, aspiration pneumonia, compromised general health, chronic lung disease, choking, and even death may be a consequence of dysphagia. A person with dysphagia may require texture modifications that make a food or a liquid easier to swallow. What is the IDDSI dysphagia diet framework? This is the International Dysphagia Diet Standardization Initiative. It is fairly new since it started in 2013. Its purpose is to meet the needs of individuals with dysphagia across age, setting, and cultures. The IDDSI dysphagia diet framework, as shown in this picture, is explained in a pyramid form. The IDDSI framework consists of a range of 8 levels from 0 to 7. The drinks are measured from levels 0 to 4, and the foods are measured from levels 3 to 7. How can you tell if your liquid is the desired consistency? The IDDSI provides you with a flow test that is intended to confirm the flow or textural characteristic of a particular product at the time of testing. What would you need? The required materials are a stopwatch and a 10 milliliter syringe. These are the instructions to perform the flow test. Remove the plunger from the syringe and discard. Cover the nozzle of the syringe with a finger, making a seal. Fill in 10 milliliters of liquid. Then you will release the nozzle and start the timer. Stop at 10 seconds, cover, and check milliliters amount left in the syringe. In this particular flow test example, the consistency was water, which is a thin liquid described as a level 0. Therefore, we did not have any liquid remaining in the syringe, since it flows faster than any other liquid consistency. If you do have any remaining liquid in the syringe, please refer back to this chart to confirm the consistency of the tested liquid. Why do we thicken liquids? Thickening the liquids is meant to slow the flow of liquids and allow more time for control in the mouth, as well as more time for airway closure, which could potentially reduce the risk of aspiration in patients with dysphagia. However, thickening liquids does not work for every patient, and it does not guarantee you that they'll stop aspirating. Plus, the taste or sensation of drinking thickened liquids is not too pleasant. In fact, some patients have even reported a reduced quality of life when they're on a thickened liquid diet. However, if you do need to thicken a consistency for a specific diet, I'll discuss one possible method to do so. Instructions depend on the thickener or thickening mix you're utilizing. However, you can always verify the end results of the thickened consistency with the flow test. In this particular case, I'll explain how to thicken liquids utilizing Simply Thick packets. These are pre-measured and easy to use. You'll need 4 ounces of water, the packet of desired consistency, which contains 6 grams for mildly thick, 12 grams for moderately thick, and 18 grams for extremely thick, and a utensil to mix. You should note that Simply Thick likes to utilize names like nectar, honey, and pudding since they are the terms that were utilized before. Now let's go over the instructions. You will first open the packet and pour in the water. You will mix with a utensil like a fork, whisk, or spoon for 30 seconds or until it has thickened. You'll feel the liquid heavier than when you had begun. And then it is ready. You have officially thickened a liquid. Now that I've discussed the technique for thickening drinks or liquids, I will now provide you with the examples for levels 0, 3, and 4 that I found at home. My first example was water. This is a level 0 or thin. On the flow test, this should be less than 1 milliliter remaining liquid in the syringe after 10 seconds of flow. My second example was honey. This is a level 3 or moderately thick. It is defined as having less than 8 milliliters of liquid remaining in the syringe after 10 seconds of flow. It usually drips slowly in dollops through the prongs of a fork. My last example is the Jello. This is a level 4 or extremely thick item. It is described as sitting in a mound or pile above the fork. It does not dollop or drip continuously through a fork and holds its shape on a spoon. Those were only a few examples that I found at home. However, for level 1, slightly thin, you could have had milk or tomato juice, which is thicker than water. For level 2, mildly thick, you could have had nectar or a milkshake. And for level 4, another example you could have had for extremely thick would have been yogurt. As you can tell, there are many different consistencies, and don't forget that you can always test them using the flow test. In conclusion, we have discussed the IDDSI dysphagia framework as well as going over the technique for thickening liquids. I hope that now you have a better understanding of both, and I will attach a video link for you to actually watch the procedure. Thank you for watching.